Good morning, everyone. Today is Wednesday, May the 6th. I'm Jen Bordeaux coming to you with another segment of Family Law Uncorked. And today I am joined by Tina Kinnan with Simply Thrive Therapy. Say hi, Tina.
Hi.
And today we are going to be talking about mental health. Everyone is saying thank you to our healthcare heroes and our front, those battling the front lines in our hospitals and clinics and everything, which is absolutely necessary. And I completely agree. But I think some of our mental health heroes are kind of our unsung heroes that we aren't focusing on quite as much, but definitely deserve some gratitude and appreciation as well, because they're playing a key role in helping everyone get through this public health crisis in unprecedented time. For sure. So we want to talk a little bit about how important it is to focus on your mental health, some normal things or some things you're feeling right now that are completely normal and validated, and just kind of talk about that as a whole. So Tina, if you don't mind, first just opening it up and introducing yourself and tell everybody a little bit about Simply Thrive.
Sure. So my name is Tina Kinnan. I'm the owner and also a therapist at Simply Thrive Therapeutic Associates. There are 10 of us therapists there, and actually now there's 14 of us. My number's off. So we're growing and we have more clinicians. Right now we have a lot of groups going on as well. So this is a time when it's really helpful to have some online groups when everybody is kind of stuck at home and have some connection with people. We're doing both. Well, in about 2 weeks, we'll start doing some in office, but we're doing all telehealth at this point right now. We see kids all the way from tiny little kids. I have a play therapist that works with the little guys all the way up. And so everybody kind of has their own specialty.
Awesome. And we've known each other for a few years now. So to hear that you guys have 14 therapists, that is amazing. That's awesome.
Yeah. So we're growing up there.
Yeah, your office is physically located in Cary, but like you said, right now everything is telehealth with everything going on. So let's start there. Let's talk about teletherapy right now. I mean, obviously it has been a great resource. I know for us in office, we do Zoom initial consultations or Zoom meetings with current clients and new clients, or via telephone, whichever the person prefers. But I know for us, we have still had some people that are hesitant to schedule a Zoom meeting if they're not currently separated, because they're at home with that spouse, and it's much harder to get that confidentiality or that quiet space or confidential space away from that spouse to be able to have that conversation. And some are just kind of craving that in office. Like, no, I want to meet with you in office, or I want to go through mediation in office. I don't want to do it, sitting at a computer screen. So it's got its good and its bad for sure. I mean, right now we have no other option. It's absolutely been a resource. So how has it been for teletherapy with the mental health side of things with the clients that you guys see?
So same thing, mixed reviews. You got some people who absolutely love it. They're coming in and, they're getting online, and we're not really having a lot of issues with that. Some people it's harder. One of the recommendations I have is go sit in your car so that you have a quiet place. I've watched when other group practice owners or other therapists that are moms are sitting in their car when their kids are outside and they're trying to get their private space to see their clients while they're figuring out childcare situations. So, like personally, my hours are very flexible right now because I can to have childcare when my spouse is available and not, because he still has to go in the office. So we're just trying to be as supportive as we can to people. All of our clinicians are doing online in some capacity. We've got the kids that are, the people that are seeing the littles, and that's really hard to do online. So we're doing a lot more parenting groups or, parenting dynamics, and doing some play therapy activities over there. We are going to be opening the office up a little bit at a time over this next month to let people in that are just really struggling with the telehealth. But it's going to be a little bit before we can get all the making sure everybody's safe at the same time.
Yeah, absolutely. So you mentioned that. I love the point of bringing up about children in therapy, because I think through a lot of this, we've thought about adults, because all of the transition of moving from, working from home, if some already were, so that wasn't as much of a transition, but working from home, homeschooling now with kids. And honestly, once, Wake County, and I've heard this from a friend of mine who actually lives in Maryland as well, once they had the curriculum ready to go online, it was just, it's pretty intense. And as we were, I was in a meeting yesterday with a few other therapists, and one of the things, it was kind of a roundtable discussion, and they were talking about, screen fatigue and just being burned out. And that even kids who are usually like, yeah, give me my iPad or, whatever tablet so I can play my game or sit in front of a computer screen or, play games, that they're having the screen burnout because school is all day long. So, and I know that some focus, and with kids, there's a lot of creativity that comes into the therapy as far as, creative with drawing or, in art and, different sorts of play. So how has that been for treating children right now?
So you've got the kids who are absolutely loving it because they can walk in and show their therapist their rooms. They can, really walk around and get some stuff. So part of it is having some activities at home that are not just about the sitting on the screen talking to the therapist with the little kids. For adults, it's absolutely. I'm listening to therapists talk about how tired they are staring at the screen. It's a different way of looking. The connection's a little different. We kind of miss out some of that, the subtle nuances that I'm picking up when I'm in an office. I can only see the waist up, or sometimes, when the screen's only here up, you can only see so much that's going on. So you miss a little bit of that really personal connection. What I'll tell you is that I work almost primarily with teenagers and their parents. So when the teenagers go off to college, a lot of times they'll do telehealth with me. And I've been doing this for years, telehealth with teenagers once they go to college around the state. And what I find is that when they come back, that session, when they come back to the office, we can get a lot of stuff accomplished because there's just a different energy in the office. And while we need to be, doing telehealth, there's a lot of things that we can still get accomplished.
Yeah, absolutely. I'm so glad it's been a resource. We had somebody comment, teletherapy has been great for him. But he does prefer in person, but he's still glad to really have this option.
Yes.
And personal plug, that's my brother. So hi, Jeremy. Thanks for tuning in.
Hi.
So that's great as far as a kid. I didn't even think about that, like being excited to show you instead of coming into the office, your office or, one of the other therapist's office, to say, hey, look at my room or look what so that is a fun side of it. That's great. So overall, looking at adults and children, I've seen a lot of stuff on social media or on, mainly social media, because that's where everybody is right now, of things of how important it is to focus on your mental health or having this like emotional roller coaster of how you're feeling from day to day or week to week, or maybe a few days. And then, so what can you kind of expect right now? Even if maybe you don't normally have these sort of feelings, what are some normal kind of baseline things that people might be experiencing or feeling right now that under normal circumstances maybe they haven't felt before?
So I think everybody's grieving right now. This is a big grief thing. If one of the things I say to my clients is, if I were to take Corona out of this and I just said, all of a sudden you have to go home and work in your house and you can't go and see people and you can't go and do the stuff you normally do, and the rest of the world is going normally, you would feel that grief of losing what you had. And so not only, so everybody's going through this, everybody's going through the normal stages of grief, and which is, denial, bargaining, anger, depression, and then finally we get to acceptance. And it's normal for those moods to kind of go up and down a little bit. It's not uncommon. There are days I'm in a lot of groups with other therapists, and just listen to when we talk to each other, and just having those people to process that with, so that you can say, I've got my venting buddy when I'm feeling that way, and how do I get to the next solution? But we're all grieving the loss of what our life looked like, and it's going to be a little bit before it goes back. And it's reminding the self that we're not going to stay in self-isolation forever. We're not going to stay here forever. This is going to eventually get better. And it'll be different when we go back for a while, but we will be going back. And you know, I saw this on Facebook and I love it. We're not in the same boat. We're all in the same storm, and everybody's boat looks a little bit different. And it's understanding that we can have empathy for each other because we understand it. But, you know, I get to work from home, and that's just a very different boat than somebody else who doesn't have a job. And it's understanding that each person is in they're having their own feelings about it, and those feelings are okay. You know, nobody expects everybody to just have perfect mental. I mean, I have not met anybody who's just had no emotions about this at all. So, you know, it's just absolutely normal to have feelings about it.
Yeah, I mean, I think I like that we're not on the same boat. We're all in the same storm in our each individual boats, because we did a Facebook Live a couple weeks ago with some of the New Direction team members that have the children, and their children are all of different ages. There was a 3-year-old, a very active 10-year-old, and then a high school senior, so a 17-year-old. And each situation, I mean, just with those varying ages, the situations were different, and some of them were the struggles they were feeling were the same, but also, you know, very different. And then I think about myself and a couple of other team members that don't have children. And I think it really hit me, and I try to be a pretty positive person, but last week it hit me hard. And I think it's because when we first transitioned, I was so busy with helping to get the office transitioned and what my role with the firm was going to be in all of this and what I could do, that I didn't really take time to focus on exactly what was happening. Mm-hmm. And then last week, I kind of finally had the chance to let that settle a little bit. And I, I said that I self-diagnosed with positivity fatigue.
I like it. I like it.
I think I had just, you know, tried to have such a positive outlook, like we're going to get through this, and, you know, and being there for different people in my life with that, which I love, and I'm glad that I can play that role. But last week it hit me like a ton of bricks, and I was burned out. Like, it was like I was having a hard time caring about, like, doing everything I need to do for work, or, oh, it's a really nice day outside. Normally I'm like, oh, I want to get out there and feel that sunshine. And Saturday I was like, nope, I'm gonna stay right here on the couch, you know. I just had to recharge, and it's definitely gotten better, but it's taken a few days. And so it is very different for people. And I just hope that people use the resources that they have. I also found myself, and I don't know if this sounds weird, or maybe you can speak to this, kind of overbooking my virtual social calendar. So I was doing all kinds of, you know, FaceTimes with friends, you know, which has been a great opportunity to catch up with people. But I have a weekly virtual trivia that I've been doing with some coworkers and family members, and then doing other, you know, FaceTimes with friends to catch up and check in on them. And I kind of realized I was like kind of doing something almost every evening. And I was like, Jen, you don't do this on a normal basis, you know? And I kind of had to take a little bit of a step back from that. So is that a thing that people might experience if they're trying to fill all of their time to deal with things?
Well, I think it's a different dynamic. I mean, when you're doing, you know, even when you and I are talking right here, when we've done a Facebook Live before, we were in office, and it's just a different connection. It's just a very different connection to be in the office with somebody. So we're losing a little bit of that. And we're kind of lonely. So especially people who live by themselves, you know, who don't, or have one or two people in the house, there's a lot of loneliness that, you know, the word social isolation really means a lot more. So my kids I have twin 3.5-year-olds, and I'm just at a different point, you know, with them, because they miss preschool, they miss seeing their friends, they miss that stuff, but it's not, to me, it's different as a parent than somebody who's got a 17-year-old. There are some amazing parents who are working full-time, seeing, you know, so you're talking about, you know, what you're talking about, having a whole bunch of things, wanting a whole bunch of connection with people, on top of working full-time, on top of becoming their kids' teacher, on top of having the kids home at all times. And it's stressful. And it's, you know, so one of the things I recommend is you connect with somebody every day outside of your house. at some level, and it's finding the balance. So what you're learning is what the balance is for you of what you can handle. And if you didn't do it beforehand, it's kind of like reining that in. I have a couple of, I got two different groups that are connecting, that we're group practice owners and we just get together and talk about stuff. And last week we were in the same place as you. Last week we were all like, we're good, but we're struggling. And so it's just having that group of people to just chat with and say, what does that mean? How can we just feel our feelings and know that it's okay to feel them? And there's not a lot of solutions necessarily. So how do we reframe it? And kind of walk through it. And it's we're exhausted. This is, again, if I were to take everybody out of the equation and just look at an individual person and say, that's exhausting to be at home and to do your life completely different than normal. It's really exhausting to do that. So taking a weekend, that sounds like a great idea. So
yeah, well, and I think myself, I'm not going to speak for everyone, but I don't think I'm alone in this, and that it's hard to fathom how do I have more time, downtime, so to speak. I can't go out to all these places or travel to these different places, or I'm working from home, which is just a little bit different. Like some days I'm slammed, other days I get up and take a break and go cook something or take the dogs for a walk or whatever it may be. So it's hard to grasp, how do I feel so tired or fatigued whenever I simultaneously seem to have more downtime, you know what I mean? But it shows how much, your mental health and mental state and those emotions play into, how you feel physically as well. So it's very, very different. And kudos to all the mental health providers for being there for us to help us through this as well, because you guys are experiencing it too. So not only are you being there for those of us, all of us going through it, but then you're also going through it yourself. So how do you guys, from a therapist perspective, how do you guys balance that?
So, I mean, I really, you talked about that, positive fatigue area, but I really sit in that is that I feel really lucky because, we talk about people on the front lines. Well, I look at the hospitals and the doctors, and those people have masks on and they're touching people. That is the front lines. We're not there. I get to sit very safely behind a screen and chat with people. And I feel very lucky that I get to be supportive and that our team gets to be supportive for people, and we get to serve our community, and we get to do it at a safe distance. So when we get to do it back here, we can be of service to other people, making sure we're not getting sick, making sure we're not getting other people sick, so we can be having conversations and really working together. But for me, it's really, what is it, 29, I saw that 29% of people get to work from home. And I feel really lucky to be in that percentage, that we didn't have to close our business down, that we get to continue to come to the office, we get to continue to serve. So we're just in a different group. It is hard. I'll tell you, it's hard work being running a business, seeing clients, and having kids at home at the same time. And so it's making sure I have the right supports in place. So this is an absolutely wonderful time to reach out to therapists, because there's plenty of services available. If people want to call our office, if we don't have somebody that works with the kind of population they're looking for, we refer out all the time, because we want to make sure people get the right fit. And, so it's making sure that people have the right supports in place, more than just a therapist, making sure they're connecting with their people. And that's what we're doing. And so, one of the things we've been doing in our office is having a weekly check-in to see how all the clinicians are doing, making sure everybody's doing okay. And that's been really helpful, to just make sure. And I'm reaching out to them, and we're all reaching out to each other to just have those connections. It's amazing how much you talk to people just passing each other in the hallway. And it's easy to miss that. It's easy to miss those little tiny 2-minute conversations. So
absolutely, we've all been feeling that too. We're, there's 11 of us in our office, and we're all very close, and we're very blessed by that we all get along so well. But it is, I mean, we have team check-ins 3 times a week, and things obviously look very different for us with the courthouse restrictions, and that not very, very minimal hearings are actually going on. So we've still been doing virtual mediations and everything, but it's the same thing. I miss just being able to walk up front to China and check in and see, how intake calls have been going, or having people come into the office, or having team lunches and stuff like that. We all do miss each other dearly, and look forward to when we can get back into the office. But of course, we know the seriousness of the issue, and of course want to play our part for the being safe and healthy and everything. So we miss it. We definitely look forward to it. And you're right. It is amazing how many, just those little interactions of walking through the hallway, or like my office neighbor, as I call one of the attorneys, missing her and just being able to pop over. My office has this round fuzzy chair in it. And because I don't really have clients come into my office. So some people would kind of use it as a getaway for just a few moments from daily activities. And so they're like, oh, I miss the fuzzy therapy chair. So all those small things, but it's given us a moment to realize, how lucky we are to have those things and to have those relationships and those connections. So obviously, with everything that's been said, it is extremely important, obviously, to take care of your physical health, but your mental health as well. And I know even with physical health, my family is in the medical field, and my stepdad says all the time, part of physical recovery, a large part of physical recovery with anything is your mental state, your mental attitude towards it. So definitely important to keep it in check. Before we wrap up, is there anything else that you want to add to this, or just say to people in general as far as their emotions and feelings through all of this?
So, the conversation I have with my clients a lot of times is we look at a couple of things. When I have somebody who's gone through a really severe trauma, we go back to the basics. So what are the basics? Are you getting up and moving? How are you eating? So, are you getting enough fruits and vegetables and proteins? And are you drinking enough water? And, and then how are you sleeping? So those are the main things. So right now, people are needing a little extra sleep. So what I find is people are staying up really late, and then they're getting up at their regular time. So they're really tired, or they're sleeping in a little bit, but it's not the same. So if you normally go to bed at 10:30, now you don't have to do your commute, and now you're staying up until 12 or 1, and then you're getting up just a little bit later. There's a little bit of sleep that's being missed. I'll tell you, for me, I'm not a big exerciser, and walking to my car apparently in the offices and to stores and stuff like that apparently is a lot more exercise than going from the kitchen to the room to the bathroom. So it's getting out and walking and making sure that you're getting that sun, and we need that vitamin D from the sun. So getting outside and getting some fresh air and walking is some form of exercise is really helpful. Those are the three things that I work with people on right off the bat. The next thing we look at is their schedule. So, kids, take that, teenagers and stuff, for instance. If you got up at 5 o'clock in the morning and now you're sleeping until noon, that's like a whole different schedule. So it's really hard to go back and forth between them. So when I have adults who got up at between 5 and 7, and now they're sleeping until 9 o'clock, that's a huge difference in time. And it's trying to stick as much to your schedule as you can as possible. If you normally get up at 5 and you're getting up at 6 or 7, that may work for you, but it's making sure you're getting plenty of sleep, and you're kind of sticking to your schedule as much as possible. Because when all the days run together, it can really mess with your head when you're going, is today Thursday? Is today Wednesday? What day is today? Is it Saturday? And so it really gives some definition, getting up and doing what you normally do. So, for me, I still get up and I still go about my morning routine of getting dressed, getting ready, putting on as regular clothes as I can to really show the differences in the day. Those things can be very helpful. And just, we're reminding ourselves we're going to get back to what life was before, and sitting on our PJs all day is not going to help us get there. So it's kind of getting, keeping our mindset in a good place, and then practicing those reframes of, this is not going to last forever. What do I have that's working? Who do I need to reach out and talk to? If people that live by themselves, reach out to them and be support to them, because that can really help us feel better. And if you need some supports, go ahead and reach out to people and schedule those times to chat with people. So
yeah, those are great tips. And since you mentioned there at the end, as far as reaching out to people, that do live alone and whatnot, because I know the whole situation with assisted living facilities and hospitals and not being able to visit loved ones that are, are in the hospital or in these different facilities is terrible for people. I mean, it breaks my heart to think about. But there is, we recently did a Facebook Live with the lady who founded Activate Good, which might be another resource for people, because there are volunteer opportunities right now, which might be something that, I mean, being, to volunteer or be philanthropic, there's just a fulfillment that you get whenever you do that, whatever level it may be. It does not have to be monetary. And so Activate Good is a company that they connect you with those volunteer opportunities, to include ones that are happening right now that can be done virtually. There was a couple of the ones she was mentioning was placing phone calls to to the elderly or to those in assisted living facilities, just to check in and say hi. Because where do you start? You're like, oh, what do I do? Just pick up the phone and call a random nursing home, So having a company like or an organization like Activate Good helps with that. Another one was individuals that speak Spanish, reaching out to Spanish homes and making sure that they're understanding the information they're getting the latest information, understanding what's going on with COVID. So there's still opportunities. Food banks are still ones that are happening in person with, health guidelines, of course, but so there's still opportunities. And so I think that might be another thing, if someone's schedule allows, or, they have the opportunity. And there's different ways to get kids involved. They have opportunities for kids to get involved with some of these things too. So I love that. And, just reminding ourselves that it is temporary. And I'm a planner, so it's hard for me to not really be able to make plans. I was supposed to be going to Greece in June, and that, obviously isn't happening. And so, we're thinking about, well, maybe in the fall, maybe we'll be able to do this. But, it's still, speaking in hypotheticals, but it's still fun to think about what if or when we get to do these things.
And that's a really great activity to do, is to plan a wonderful vacation. That is a great way to handle this, is to say, we don't know when we're going to go on our vacation, but let's plan something really fun, so that when travel restrictions are lifted, it may be next summer before we can all get out and move and do stuff. But it's really beneficial to have those conversations and to plan fun stuff. And it gets you out of the current moment. I'm sorry, my screen is frozen right now.
Looks like my internet crashed, but folks, thanks so much for joining us for that. I hope you enjoyed. Oh, there we are.
Sorry.
No, that's okay. I don't know if my internet crashed or what happened, but that's the beauty of technology. At least we got us back in here into Facebook Live. But yeah, no, I love that. Looking at a vacation and what your dream vacation would be. You're taking the time to really plan it and see what that looks like. And even though you may not quite know when that's going to be, but it's always good to dream, right?
Plan stuff, understanding that at some point you will be able to do it. It's just not today. And, like, one of the things we love doing is going to the beach. And this may not be the year we're going to go rent a place and be down there long term, but where would we like to go? Do we want to take a trip to Disney at some point? What do we want to do that would be going to Europe? Doing all those things is really fun. Absolutely. Yeah.
All right. Well, I thank you. This has been full of great advice. We've had several people watching and some people that have commented. Someone even said this has been full of great advice. Thank you so much. So thank you for taking the time to join me. And for those watching, what is the best way for someone to get in contact with Simply Thrive if they're interested in services and, have questions, all that good stuff?
So you can give us a call at the office, which is 919-636-0762, or you can send us a message on our website, which is www.simplythrivetherapy.com. We have a little what do you call those things? Like a little box you can check and put all your information in, and we'll get back with you via email. So either way is great. And we have somebody that answers the phone, and if they're not available, they'll return your call within 2 to 4 business hours. So we're at the phone calls. We also have 2 interns that work for us. So when people need low cost therapy, if anything's going on, we also have that available, where they see people for $30 for the 55-minute hour. So that's a great option as well. And again, if we don't have a person that works with somebody, we're more than happy to help people find them in the community, because we want to get people with the right fit. It doesn't do us any good or them any good to see a therapist that's not the right fit for them. So we prefer to get them in the community with somebody that's going to be great for them.
Awesome. Great to hear. And I know a lot of people ask as far as insurance is concerned, but you guys take some insurances, correct?
We take most insurances. We take Aetna, Blue Cross Blue Shield. We do Cigna, and we have Magellan and Beacon as well. We do not take United Healthcare or any Medicaid or Medicare. So those are the ones we don't. And then we also have an out-of-pocket, and we will submit your stuff to the insurance through out-of-pocket or through out-of-network. So.
Gotcha. Well, thank you for all the wonderful work that you and all the therapists there at Simply Thrive are doing and continue to do to help us all through this. Thank you for joining me today. Safe and well wishes to you and your family and those cute little twins.
Thank you.
And we will definitely see you next time. Okay.
All right. Sounds good. Thank you.
All right, thanks.
Okay.
Yep.
Bye.